Hello everyone, I'm Tim Lucas. I'm going to talk about the MSc in Population Health Data Science. There's a Q&A if anyone wants to ask questions. Happy to ask either general questions or even quite specific questions, especially because some of the kind of requirements for this course are a little bit unusual or perhaps not totally clear. So happy to answer any questions, put them in the Q&A and I'll see them and answer them probably at the end. And yes, so like I said, I'm Tim Lucas. I'm co-lead of this new Masters in Population Health Data Science here at the University of Leicester. And I'll give you a little overview of what the Masters is about. So first off, what is Population Health Data Science? So it's this intersection between population health and data science. You can ask 1,000 people what data science is and they'll all give slightly different answers. Here we're looking at it being a science that uses complex data, a bit of a focus on predictive modeling and machine learning, perhaps more than some of the more classical statistical methods that you might find in other masters. It's absolutely about collaborating and working with experts in the field. So as a data science, you typically wouldn't be the expert in perhaps the disease that you're looking at or in the area of population health you're looking at. You'd instead be the expert in data science, in modeling and encoding. The kind of day-to-day of what this can be, a lot of exploring data, visualizing data, combining data in various ways, typically with statistical software that's typically code-based. We'll see some of those later. Interpreting and presenting these results. So depending on who you're working for as a practicing data science, that might be presenting results to the scientific community or to the kind of your higher ups in your company or the people in the NHS who you're working for, whatever the case may be. And one of the sides of population health, specifically data science, that's quite unusual is perhaps a bit of a focus on health services support. So things like forecasting how much need there is for healthcare in 1 week, 1 year. We'll see a little bit of that later, but that's one of the things that we sort of expect might come up more commonly, and especially in the kind of industry side of health data science. That's kind of one of the things that comes up a lot. So just to give some examples of the sort of things that either we're working on here at the University of Leicester or other people are working on in various places. On the left-hand side here, we've got some data of malaria cases, and they're at this low resolution, and we're using complex statistical and machine learning models to make these high resolution predictions of malaria incidents. So how many cases of malaria there are per year. Those predictions are on the right. This panel in the middle is looking at how much blood the healthcare service in the UK needs. So every time someone has a surgery or every time there's a severe injury, various other situations, people get given blood transfusions. And so the hospitals need to know how much packets of blood they need sitting in their fridges waiting for people. So this is some work forecasting that requirement for blood into the future. And then on the bottom right, there's actually just some made up data, but it is a project I'm working on, trying to predict who will have long COVID or won't have long COVID, given that they're currently undergoing a sort of a severe case of COVID. So this is looking at people in hospitals with COVID. How do we know in 6 months or 1 year whether those people will have recovered from their COVID or be suffering quite long-term long COVID? So looking at clinical factors, but also genetic factors and various other predictors to try and work out who might be suffering from long COVID into the future. So this is a new course, new for this autumn. We'll be developing advanced data management and statistical skills, with also a focus on employability and and yeah, with the kind of the goal to be going into the medicine or healthcare industries, either academia, industry, NGOs, or various other kind of parts of the research world. So that, and we cover a wide range of skills, so sort of research skills in terms of how do you go and read papers, how do you understand what you need to, you know, how much of the sort of biology do you need to know. We're going quite obviously quite deep into data and statistical computing skills, so that will be using R and Python absolutely on a daily basis. Also looking at Git, which is a software for it's like track changes but for software basically. So if you want to start getting good at software rather than writing a messy script that you can just about manage, we're sort of moving towards this kind of more robust software development side of things as well. Communication skills, so how do you take some work you've done and communicate that work to various stakeholders. So that might be, again, communicating in a research paper, but it might also be communicating to the public. It might be communicating to people in the company that you work for, perhaps people that don't know anything about statistics, don't know anything about data. You know, how do you quickly summarize a piece of work for those sorts of people? And then finally, I think fairly clearly, we'll be learning advanced statistical modeling and machine learning methods, an array of methods that kind of either feed into each other or contrast different aspects or different use cases in research. So the MSc is based in the Leicester School of Medicine. It's taught mostly by people in the biostatistics research group, but also researchers in the genetic epidemiology group. Nearly all of us are research active academics. There's a strong overlap with the MSc in medical statistics. So if that's interesting to anyone, I'm happy to talk about what's different or the same between the two courses, but quite a large chunk of the course is the same, and quite a lot of the hours of the course you'll be sat in the same room as people studying the MSc in medical statistics, but with a focus on data science instead. The MSc in medical statistics is a very long-running, well-recognized degree that has been feeding into industry, feeding into clinical trials units, and feeding into academia for, I don't know how long, 20 years, 30 years, a long time. And so it, you know, we've got the benefits of that kind of long-standing, you know, experience, but we're kind of, this new degree is focused on some of these newer skills that we've been speaking to industry reps, and there's some of these data science skills are not fully represented in the medical statistics degree, so we're just kind of trying to you know, respond to what industry wants. So it's a one-year full-time course starting in September and ending September a year later. Kind of the first, you know, the first whatever it is, 6 to 8 months is taught modules, a lot of computer labs, a lot of lectures, a lot of kind of project work, sort of small project work and small coursework. And then this long project at the end, 3-4 months of one big project that really kind of, you can really go deep into a particular area. All the modules are focused on medical and health data. It's all, you know, it's none of the modules are taken from other courses or anything like that. It's all very specifically about medical and health and how we do data science in that area. So the core modules are these ones here. So foundations of health data science. So, you know, a lot of just like real basics, some of this course, but then going a lot into in inference, for example, we go really into the mathematical details of what statistical models are doing and really fundamentally how they work. A week on machine learning, a week on advanced health data science, which will be going more into that software development and how do we, you know, take a new method and really develop software to make that available to others, and some other modules. And then there's a few options towards the end of the course so that you can specialize in health technology assessment or genetic epidemiology. And then finally, this large project. It's an opportunity to apply the skills you've got and to really, like say, really go deep into one particular area. Some of the projects that come out are really fantastic pieces of work that are really developing brand new methods and testing whether they work and presenting very clearly, the strengths and weaknesses of those newly developed methods. So the talk content, there's quite a lot of maths involved. We kind of, we're using the language of maths really to clearly and robustly communicate these concepts. So you do really need a quantitative background to be studying this degree. You need at least A-level maths and probably a quantitative degree as well. Maths, physics, economics, computer science are all fantastic. That's definitely the sort of thing we're looking at. If you have something more grey, you can talk to us and we'll let you know whether it's, whether this degree is right for you or not. The modules are maths heavy, but this is a good thing, right? You're really, really getting to the grips with what these models are doing from the very basics all the way through and getting a deep understanding of statistics and data science. If you don't have a quantitative background, there are alternative degrees here at the University of Leicester. We have a number of MScs in data science now. Most of those other degrees are much more kind of conversion courses where you don't need a quantitative background. This degree, you kind of need a quantitative background. You'll be getting into the nitty gritty of what the maths is what maths is happening behind the shiny software that you sometimes see. So the degree is structured in a slightly unusual way as well. We teach in these week-long blocks. So for 1 week, for example, this second week, you'll just be doing statistical computing, kind of, not quite, but kind of 9 till 5 for five days. So whereas many degrees are, you study 4 modules throughout the term and you do a few lectures a week for each module, in this degree, you spend a week doing one topic, really focusing on it, really getting in depth, and then every sort of other week or every 3 weeks, you'll have a coursework week where you don't have any like face-to-face teaching. You go and do the coursework for the modules you've just covered, and part of that coursework is really kind of reinforcing the things that we were taught. So, for example, in these first 3 weeks, you'll have 2 talk weeks and then a coursework week. And by the end of that, we feel that nearly everyone will be really strong at statistical computing. They'll have a really good foundation of the methods being used in data science. And then we can build on that. So that's kind of the point of this, is that the later weeks fully build on the earlier weeks in a way that hopefully makes sense. So that's just highlighted again here. Of course, assessment. So all the assessment is based on sort of real examples and real data sets. Nearly all the assessments will be some sort of data analysis of a data set using either Python or R. Often these will kind of be problem-based exercises, so kind of going through quite clearly, like, please do this little bit of analysis, please do this little bit of analysis. But later on, especially, it might be more like, go away, do a whole analysis, and then write that up as a report. There's some group work. There's one exam. The industry reps that we speak to say they really want to see some exams still. They want to know that people can do statistics under, some sort of work pressure as well. So there is some exams, but only one. So this is a new course, so we don't have any previous alumni to kind of follow and see exactly where they go. So we're basing this partially on where medical statistics graduates go, and partially on where we think this new course makes sense. A lot of our graduates go on to the pharmaceutical industry. A lot of them go into research posts in statistical consultancy, or perhaps working for NGOs or working for kind of government research departments. Perhaps we're going to work directly for the NHS, more on this kind of operational side rather than kind of research or directly health-based side. And a lot of people go on to do PhDs. This is one of the real nice things we see in this degree, is that people come, do the master's degree, and then stay with us for their PhD for 3 or 4 years after that. It's quite common. So yeah, we look forward to welcoming you into our research group, the Biostatistics Research Group, and into the wider Population Health Science Department. Lots of academic staff here, researchers and PhD students. You'll kind of be mingling with these people to various extents. We've got lots of expertise in data science, medical statistics, epidemiology, and other areas. And there's kind of these research seminars throughout the year that you can attend. And here we are. Here's the Biostatistics Research Group.